This is the Becker's Healthcare Podcast, created by the team at Becker's Healthcare, a multimedia company devoted to the people who power U.S. healthcare. 4 new 15-minute episodes are released daily, containing industry news, analysis, and thought leadership from powerful healthcare decision makers. Support our show by leaving it a 5-star rating and review on Apple Podcasts or other platforms you use. It's a chance to tell us what you like about the show and act on your feedback. Thanks for listening. Now here's the episode.
This is Scott Becker with the combined episode of the Becker Private Equity Podcast and the Becker's Healthcare Podcast. I'm thrilled today to be joined by two leaders in the healthcare private equity practice at McGuire Woods. We're joined today by Holly Buckley, who chairs the healthcare practice, and Tim Fry, who's a brilliant partner who works across healthcare and private equity, and at one time worked with CMS. They're going to talk today about a white paper that's now in, I'm not sure which iteration, but it discusses 27 different niches that private equity investors are investing in healthcare. And they're going to take us through about 6 or 7 of those areas. Now, for people that want the entire paper, which I think is 27 different niches that they talked about in the paper, it's Holly Buckley and Tim Fry and a number of other authors from McGuire Woods. You can get that paper by contacting Holly Buckley at McGuire Woods or Tim Fry at McGuire Woods. And the email addresses are tfry@mcguirewoods.com or hbuckley@mcguirewoods.com. But again, you can always get that also by if you contact Scott Becker at 773-766-5322. We'll also make sure that you get that paper. Holly and Tim, without further ado, let me ask you to take one moment to introduce yourself. Then I know Holly's going to talk us through 3 of the areas that are covered of the 27. Tim's going to take us through another 3 of the areas that are covered. And thank you for joining us. Holly, can you take one moment to introduce yourself, and then Tim could ask you to do the same?
Yeah, absolutely. Thanks, Scott, and thanks as always for having me on the podcast. So as you mentioned, we've written this white paper. It's been redone a number of times over the years as these areas have evolved. And it's a really enjoyable paper to work on because it really encapsulates a lot of the work that we do on the legal side here day in and day out. So as we've talked about before, I work extensively in healthcare private equity. I do work with private equity funds, private equity portfolio companies, as well as traditional providers in the healthcare marketplace on M&A and regulatory issues. And a lot of the work we do is in the PPM, behavioral health, pharma services space, and a lot of the areas are reflected in the white paper. And so we do look forward to sharing with you. And just one plug, a lot of these areas will be highlighted in our healthcare private equity conference in May of 2024. So it's May 8th and 9th, 2024 at the Ritz-Carlton here in Chicago. And so we can definitely get you information on that as well if you want to reach out. And I think Tim is going to introduce himself next and is also going to give just a high-level overview of some of the headwinds and tailwinds we're seeing in the market before we talk about a few of the select niches that we're seeing growth in.
Thank you, Holly, and thank you, Scott, for having us. Tim Fry, I'm a regulatory attorney, assist many of our healthcare private equity funds and their healthcare provider platforms address fraud, waste, and abuse, billing and compliance, host of other regulatory topics. Most of my time is spent on the provider side. And that really then generates what Holly mentioned of kind of this interest as a firm. I think we had, 30 plus authors touch the white paper to get their different views so that we could really speak to each of these niches. And it really is an interesting time to be working with private equity funds in the healthcare space because they've run in this year with the interest rate increases of the Federal Reserve, kind of some headwinds that have slowed the deal flow, especially late 2022, first half of 2023. There's also been a lot of uncertainty around economic conditions that sort of put deals are taking a little longer than they were a couple of years ago, and really challenging folks to think creatively, rethink valuations. At the same time, especially for provider investors, PPM investors, there is a new interest among federal and state regulators on antitrust issues and kind of physician roll-ups, maybe requiring transparency, disclosures to state attorney generals. All of those things have kind of put some, headwinds in front of investors, and they've had to rethink their investment strategies. And I think some of the areas we talk about today that are of great interest and growth, there's still a lot of tailwind in this investment. There's a lot of dry capital. Healthcare is is 1/5 of the U.S. economy and continues to grow year after year. There's still a huge interest in provider investments as well as payer services, pharma services, which we'll talk about as well. And I think you get that kind of, yes, there's some headwinds, but there is still a lot of private equity interest. And we'll talk about 6 of those areas where we see particular interest. And I'll turn that back to Holly for that.
Yeah, thanks, Tim. And so the 6 areas we're going to touch on briefly today is areas that we're seeing a fair amount of activity and growth: behavioral health, med spa, pharma services, payer services, cardiology, and women's health. I'm going to kick off with the first 3. So behavioral health is a sector that we're seeing just really great activity. This is a really broad sector. It includes things like substance abuse and addiction treatment, various different facilities and provider types, such as inpatient psych hospitals, mental health service providers, inpatient and outpatient eating disorder programs, as well as autism and educational therapy providers. And so when someone says they have an interest in a behavioral health deal, our first question is always, what subsector are you looking at? There's a number of reasons that this sector's been doing really well. The opioid epidemic and the COVID-19 pandemic really increased awareness of the need for mental health access and parity. And this is likely to result in continued or even increased interest and investment in the sector in coming years. And in addition to that, we also have seen regulatory changes with the federal government continuing to support expansion of behavioral health access by expanding payment to certain areas that they didn't previously support. And then we're also seeing the private sector through payers continuing to kind of follow the federal government and expand its reimbursement for different treatments. So just a really interesting sector, lots of creative models as well in terms of reimbursement. And we think we'll continue to see a lot of growth here.
Great. So behavioral health remains extremely active, lots of interest in a very broad category, lots of subsets. Thank you so much. And everybody knows there's a huge shortage in behavioral health. So it's very helpful to understand so much effort being made in the space, whether effective in solving behavioral health problems or not is a different issue, but really helpful. Thank you, Hal. Let me let you continue.
That's a great point, Scott. And I mean, the shortage in providers is also driving a lot of innovation through digital health solutions, telebehavioral health, and things like that. So that's a great point as well. The next sector is kind of very different that's in the med spa space. And so this is kind of purely aesthetic med spa services. It's of interest to investors for a number of reasons, including not having exposure to federal healthcare program reimbursement and even private payer reimbursement. It's just kind of a cash pay business for the most part. And this is these businesses generally offer services such as Botox and other injectables, as well as kind of laser hair removal and various other cosmetic procedures. And these could either be totally standalone businesses or sometimes even add-on businesses to medical businesses such as dermatology or even dental offices. In addition to kind of pure med spa provider type businesses, there's other adjacent sectors such as cosmetic and drug companies that supply products used by med spas that are also seeing an increased appetite for transactions. And then there's another sector within this that's hospitality companies such as resorts that are providing med spa services. So there's a whole tourism aspect to this. And so there's a real increased demand for cosmetic procedures and wellness treatments amongst many different demographics that are creating significant tailwinds in this industry. And the global med spa market's expected to grow from about 14 billion in 2022 to 26 billion in 2026. And so just a huge amount of opportunity here. Also, a lot of these businesses see really high profit margins, the ability to reach down market into non-medical services such as facials, massages, acupuncture, your traditional spa services, and also recurring service opportunities such as subscription models. So just the space, we're seeing a lot of activity. The final space I'll talk about, and again, these three spaces couldn't be more different, is pharma services. And by pharma services, we mean service providers to the pharmaceutical industry. And we're seeing just an enormous amount of interest from private equity investors in this space in recent years. The types of companies that we are referring to in pharma services are companies such as contract research organizations, contract development and manufacturing organizations, straight contract manufacturing organizations, contract packaging organizations, and third-party logistics companies. And the reason, or one of the main reasons we're seeing such an increase in growth in this space is the shift in the pharmaceutical industry from traditional drugs to that, are intended for a broad patient population to more specialized and precision medicine solutions that really looking at much more customized, specialized drugs. And one statistic here is that spending on specialty drugs over the period from 2016 to 2021 actually increased by 43% for a total spend of $301 billion. So this is just a huge sector of the economy. And so the other reasons that I think investors really like this space is, again, some diversification away from direct reimbursement on the provider side, and just diversification from kind of government exposure as well. With that, let me pass on to Tim, who's going to cover three more sectors.
Thanks, Holly. And I think that, diversification point goes for my first category I was going to share, which is payer services. We see a lot of investment right now in companies that work with third-party commercial payers to help them cut costs. And that cost pressure comes from the overall market. It comes from employers who are, this is their biggest expense after salaries is their healthcare benefits. And it historically has grown year over year. And the pressure they're putting on payers and third-party administrators to find cost savings just continues to grow. And so we broadly call this payer services, but it's everything from medical reviews to reduce unnecessary costs, prior authorization companies using artificial intelligence tools to now, as that expands in use, to look at things like overcoding and medical records. It's really a host of different services that payers and third-party administrators are kind of going out and getting on the market. We see that growing, and we see a growing number of deals for that diversification point. And we see a healthcare industry in the United States with, some say 4 to 5 times the amount of admin expense as our European kind of comparable countries. And so every little savings is something that payers are looking for, that employers are looking for, that the healthcare system overall can use. And so much of that is not being run out of just the Uniteds, the Aetnas, the Blue Crosses of the world, but instead they're going out and seeking that from vendors that they can partner with. And it gives an opportunity for that diversification and investment. Returning to the space I spent more of my time in, physician services, PPM models, two last areas of real growth in investment, cardiology and women's health. And in cardiology, overall, there's this large trend out of the inpatient setting to outpatient settings, very similar to what happened in orthopedics and before that, other surgical lines that move to surgery centers and in even office settings. And we see that now in cardiology. And that gives a great opportunity for PE investors and others to look at this space, partner with physicians, help them set up expensive surgery centers and office-based labs, help them with the build-out expenses, and then work together to kind of help transition those patients and save the system costs. There's a lot of great excitement around this because of the nature of physicians, investors, payers, the community maybe all benefiting in seeing costs decrease with that. What I will say is cardiology faces a situation more than others where state-by-state rulemaking around what surgeries can be done in the outpatient setting, what surgeries can be done in a surgery center, how a office-based lab, which is similar to a surgery center, but is being done for services that Medicare and other commercial payers have deemed ineligible for a surgery center, how they will interact. So there's a lot of state-by-state regulatory review. And also cardiology has, to points made earlier about the need for more physicians, cardiology has been estimated to have the largest projected shortage of any of the specialties. And so there's going to be a lot of interest in modeling to figure out how to provide that care if those shortages continue. And finally, I'll just touch on women's health very briefly. Probably should give it more time because that is a service line that means a lot of different things, and it means different things to investors, from traditional OBGYN services to kind of whole health, almost kind of homeopathic care linked with medical care, and everything in between. Over half our population are women. And so, of course, it could mean a lot of different things. And we see investments seeking that to try to use the traditional OBGYN model maybe as a medical home for women. 90% of transactions in this space have taken place since 2020, according to some experts. So there's a lot of interest here, more to come. Part of that excitement is from femtech, kind of the name given to using apps on phones to track health and link it with traditional healthcare platforms. We only see that growing. And then one other thing that's really exciting to investors in this space is OBGYNs and other women health providers have often already done things like value-based care, whether that is with site of service differentials or a bundle for the entire pregnancy to birth. They just think in terms of the need around value-based care that other specialties more in the mold of fee-for-service don't. And so investors see a great opportunity to partner with these types of practices, use that ethos, that culture to kind of drive change and build a sustainable model, work on things like infertility, genetics, et cetera, as well, because of the kind of that all-encompassing piece. So I'll turn it back to Scott and Holly, but as they've already mentioned, we do have a white paper out on this. You can reach out to us by email, again, tfry@mcguirewoods.com or hbuckley@mcguirewoods.com. Reach out on LinkedIn, and we'd be happy to share and have further dialogue here, because this is just so exciting to see this continued growth and energy around some of these sectors and see ways to kind of help improve healthcare through these investments.
No, thank you, Tim, very much. Holly, thank you very much. I have so many questions, but I think we're at about 20 minutes now. I'll probably leave those questions for a follow-up episode about how the shortages of physicians impact some of these areas, how do some of the other issues and labor challenges impact some of these areas, how do interest rates impact some of these areas. If we can, I'd love to tee up some of those questions for a follow-up podcast. Again, Tim Fry, partner at McGuire Woods, Holly Buckley, Buckley, chair of the healthcare department at McGuire Woods, both spent a ton of time with this cross-section of private equity and healthcare. Thank you to our audience for listening to this special episode of the Becker's Healthcare and Becker Private Equity Podcast. Again, we've covered 6 of the 27 areas covered in the McGuire Woods Healthcare Private Equity niche white paper on the subject. Thank you for listening.
It's so important for leaders at the top of organizations to keep learning, stay sharp, grow their networks. To help our audience better do this in a more simplified, personalized, and meaningful way, Becker's Healthcare has launched My BHC. It's your trusted Becker's Healthcare experience and more, with content, connections, events, and learning opportunities. Join the community free of charge at www.my.beckershospitalreview.com, and we'll see you there.